This is me, Rashmi Singh, and my topic is ulcerative colitis. Ulcerative colitis is a chronic disease. It's a long lasting disease characterized by inflammations and ulcers. It only involves large intestine. It causes inflamed mucus of rectum and colon. Classification of ulcerative colitis are: when ulcerative colitis involves only rectum, it is known as proctitis. If the left sided of the colon is involved, it is known as left sided colitis. When the entire colon is involved, it is known as pancolitis. Ulcerative colitis is characterized by a period of time with active inflammations when the patient is experiencing symptoms and period of time with inflammation is turned off and patient feel well. We call the period of wellness remission. Many patients with ulcerative colitis have long period of remission alternating with period of active inflammations known as flare. Some patients with ulcerative colitis have more severe flare than others. Although the cause of ulcerative colitis is not known, many risk factors can contribute to a person's risk of having ulcerative colitis, but most can fall in these three categories, that are genetic predisposition, environmental factor, dysregulated immune response in GI tract. Environmental factors contributing to ulcerative colitis are infection, smoking, and non-steroidal anti-inflammatory drugs or antibiotic. In ulcerative colitis, inflammation appears within the colon and the immune system works to combat the bacteria and viruses as it does with cut on the surface of the skin. However, the difference is that immune system is not able to turn itself off after it rids the body of the bacteria or viruses, so the ulcer remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptom of ulcerative colitis. Progression of ulcerative colitis from rectum. In ulcerative colitis, the rectum, the last 6 inches of the large intestine, is always involved. In some patients, inflammation may extend further up to colon. Approx half of the patients who do not have the whole colon involved at the time of diagnosis eventually progresses to more extensive disease, which result in new symptoms or loss of response to an existing therapy. When there is inflammation in the rectum, it cannot store contents. Because of inflammation, it cannot distinguish gas from liquid, and because of this, the patient feels anxiety. Some other symptoms of ulcerative colitis are frequent small stools, fatigue, low energy, and rarely fever. Because the rectum is always involved in ulcerative colitis, patients usually experience similar symptoms regardless of how much of colon is involved. Ulcerative colitis can affect other parts of the body except GI tract, that are joint pain, liver inflammations, osteoporosis, skin problem, eye problem, mouth ulcers, and anemia. Ulcerative colitis patients can lead normal life through appropriate management and proper strategies.